If you have fatigue, brain fog, rapid heart rate, anxiety, chest pain, sinus issues, runny nose, your tissues feel like they're swelling up, skin issues like random dermatitis and hives, very allergic-like symptoms. Don't forget the digestion part, pain, reflux, diarrhea. I would say if it's more allergy-like symptoms, you should look into histamine intolerance. A lot of people need to be on a histamine diet if they have mast cell activation or histamine intolerance. Histamine is essentially what our white blood cells release when we're fighting off infection. So our body's inflamed, histamine is released, and it's fighting things off. A good example of this is for long COVID patients. So that basically means people got COVID, and then after they got COVID, they started having all these weird neurological and sinus issues and blah, blah, blah. Okay, their body is inflamed. Their body is reacting to something. So they technically tested negative for COVID, but their body is still reacting to something. This can happen with a lot of things, a lot of different exposures in our environment, like mold or some other illness that is going to activate your immune system. So we look at histamine intolerance as a bucket. So our body is going to naturally release histamine when it needs to. We just don't want it to be overactivated. And some foods naturally contain histamine. So white wine, aged cheeses, fermented foods is huge. So kimchi, sauerkraut, kombucha. And then there's foods that naturally release histamine: alcohol, bananas, nuts, chocolate, pineapple, shellfish. At the end of the day, it's almost impossible to fully follow a low histamine diet. But if you start to take out these high histamine foods and you immediately start to feel better and maybe your sinus issues go away, that's one step closer to understanding where your symptoms are coming from and where all your food intolerances are coming from.